Okay, Friday, June 17th. Long week. Something I wanted to mention about when I was a good bit younger, what I consider kind of a corollary, a little bit of a corollary disease, and how medicine can get it wrong, is that when I was a resident back in, I guess that would have been general surgery residency. That would have been like in 89 and 90. Not doing urology then, but people with ulcer disease, stomach ulcer disease. Obviously there are bad cases of stomach ulcer disease where it causes bleeding. You can have gastric ulcers, you can have peptic ulcers in the duodenum. But nevertheless, you can have ulcer disease, okay? And they come in bleeding, and they come in bleeding a lot. And you have to put a tube in their nose and suck all the clots out of their stomach, irrigate their stomach to try to get the bleeding to stop. Of course, we don't do any of that anymore, but the point being is that we would do those things. We would put a nasogastric tube in. We would lavage their stomach. We would give them H2 blockers. I can remember how amazing it was when H2 blockers came out. One of them was, the first one was called Tagamet, histamine blocker, the H2 histamine blocker. And then there was Pepsid. And then there was, can't even remember the other one. Nevertheless, there were about 3 of them that came out there within several years of one another, but the original one was Tagamet. And that was when we thought that ulcer disease was due to hyperacidity in the stomach. So the concept was that you have histamine release in the stomach, and that makes the stomach secrete acid, and that acid burns a hole in the stomach or burns a hole in the duodenum. And so patients would be deathly ill. They'd be bleeding to death, and sometimes you'd have to go back there and take their stomach out to keep them from bleeding to death. And then some of them would have ulcers that persisted and never would heal, and you would take them back and take part of their stomach out, and we would actually do a vagotomy. We'd cut the vagus nerve, thinking that that was stimulating the stomach to secrete acid. And lo and behold, not long after that, these guys in New Zealand go, well, wait a minute. There's bacteria. There's bacteria in the stomach. There's bacteria in those ulcers. And bacteria is called Helicobacter pylori. H. pylori, as most everybody knows it now. So they started treating ulcer disease with antibiotics. And guess what? They just about cured ulcer disease. You don't ever see stomach surgery anymore unless it's for malignancy. You hardly ever see ulcer surgery anymore. You hardly ever see stomachs removed for bleeding anymore. A lot of it's taken care of with the gastroscope now too. But nevertheless, the point being is that medicine had it wrong for years, decades. They had gastric peptic ulcer disease wrong, and they employed surgical procedures for a medical problem, which was an infectious problem. So I'm pretty exhausted today, so that's really all I'm going to go through. I'll try to get another one out maybe later this weekend. But that's a corollary disease. This bladder problem that chronic bacterial cystitis is in general not a surgical disease. It's a medical disease, and it's from an infection, and it's been there for a long time. And unfortunately, because it's been there for a long time, it takes a long time to get better. So be patient. If you have any questions, you can try to send me a note, but I apologize. I just don't have time to answer all of them. Have a good weekend.